Well, from colon cancer to heart disease, there are critical health concerns that men need to take seriously. Omar Villafranca takes a look at what screenings men need to have just to stay healthy.
26-year-old Zach Sussman sees his doctor every year.
I'm healthy, but I know 50 years down the road I might not be, and I want to be able to combat it.
Dr. Stephen Lamb at NYU Langone Medical Center says men need to take charge of their health from the beginning. In their 20s and 30s, establish a relationship with a primary doctor. Get baseline numbers for blood pressure and cholesterol. Make sure immunizations are up to date. Testicular exams are also recommended.
There's a higher risk of testicular cancer in your 20s and 30s.
Heart disease is the leading cause of death in U.S. men. So in your 30s and 40s, know your risks.
You really want to know that your blood pressure is normal, that your cholesterol is normal. If you're overweight, establish a program for weight loss.
When it comes to the PSA test, guidelines recommend against routinely using the screening for prostate cancer, but some doctors recommend a baseline test at 40. When men reach age 50, it's time to start colon cancer screening. Lung cancer screenings are also recommended at age 55 for heavy, former, or current smokers. Dr. Lamb says it's critical for men to check in with their doctor to make good decisions about screening.
You need to personalize the testing based on the patient's personal history and family history and their own concerns.
With a family history of heart disease, Zach believes taking charge of his health now could be the key to living longer. Omar Villafranca, CBS News.
Experts also say it's important to have your hearing and eyesight checked about this time.